you for joining us for this edition of Up to the Minute OBGYN News with Tomeka Roberts, MD, PC. I'm Christina Roberts Brown. In the month of October, we are excited to share that our very own Dr. Tomeka Roberts was interviewed by ABC 3340 Linda Mays. In Dr. Roberts' interview, she shared how women have developed unhealthy hygiene habits and then also provided solutions. If you were unable to view Dr. Roberts' interview, we would like to share it with you today. Take a look.
Women, if you have repeated visits to your gynecologist with apparently the same problem, you might want to consider this. Focus at 4's Linda Mays found out your favorite jeans, your workout clothes, or tights might be clashing with your health.
To wear my tighter clothes, and I have a pair of Spanx just like every other woman in the world. And
34-year-old Rebecca Boggin is one of many women who've asked OBGYN Dr. Tomeka Roberts for advice on feminine hygiene to avoid nagging vaginal bacteria and yeast infections.
Bacteria and yeast are in the vagina, and that's what they're supposed to be. And it's a nice, delicate harmony. So things that can throw off your pH balance are like taking antibiotics, or getting stressed, or working out. And routinely wearing tight clothing like jeans, pantyhose, cotton-free undies, and workout gear make Dr. Roberts' feminine care list of things to avoid. Keep them on after, like, go run to the market or go to the, or go vacuum the house. They keep that moisture and that heat in there, and then that helps the bacteria and the yeast get worse. To stay clean and fresh, it's no surprise you'd think of using a washcloth and soap, but that's a no-no among healthy hygiene practices. That can cause little tears in the area, cause bacteria from the washcloth to get in that area, and also the detergent that's on the wash rag. And you might ask, what makes wearing panty liners an unhealthy hygiene practice? It has a little bit of plastic in it. It holds that heat and moisture right in that area. Over-the-counter feminine products can make bacterial and yeast infections fester. People like to put powders down there and sprays and want to smell fresh and clean from that. But those things are irritants and can cause even more problems. And then you cause more problems, you have more discharge, you have more odor, and then you end up using more of those products. Most over-the-counter feminine products make Dr. Roberts' feminine care list of things to avoid because of two specific ingredients, paraben and sulfur. Been some talk about links to cancer and things like that, so we stay away from parabens altogether. And so we definitely don't want that in that area. And then sulfur, you know, is an irritant. And some people are allergic to sulfur and don't know that it's in those soaps. Dr. Roberts, who also has a degree from UAB in material sciences and engineering, came up with a solution to healthy feminine care. She's created and tested a feminine wash for females of all ages. It has no sulfur, no parabens, natural products. It's a foam and easy to wash off.
just rub it together.
Rebecca Boggin has used Dr. Roberts' feminine wash for a while now. She says it also helps alleviate dryness.
I've used it for 2 years now since she's had it out, and I have not had an infection since.
And Boggin doesn't have to let embarrassing feminine hygiene issues cramp her style.
I still wear it, but I still take precaution and use the wash, and I don't have any problems. I don't have that uncomfortable feeling.
Yes, it's a delicate topic, but someone has to spread the necessary information. Thank
Now,
you, Dr. Roberts.
Let's go back to Dr. Roberts.
The foam
The
wash?
foam, yeah. Is that a medication?
It's not a medication. If a woman has a problem that needs to be corrected, she needs to go see her gynecologist, because the foam wash is not a medicine, but once that problem is corrected, Dr. Roberts says it helps with pH balance. And listen to this, the recommendation from the American College of Obstetrics and Gynecology is to wash with just water, and a lot of women aren't satisfied with that. So what Dr. Roberts advises women to use the feminine wash with their fingertips, not a towel. Now, to find out more information about Dr. Roberts' wash, you can go online at TomekaRobertsMD.com.
Very interesting information, and you're right, we do need to cover that.
Yeah.
I appreciate it.
Great job, Dr. Roberts. Well, that's it for us. Thank you again for joining us for Up to the Minute OBGYN News. If you haven't liked us on Facebook, please like us today. We look forward to seeing you the next time. Have a great week.